All right, everyone, welcome to our TALA hour. Thank you for suffering with us through our audio finessing that we had to do. As you can just heard, this is being recorded. We will send out Carmen's presentation as well as the recording once it comes through off of the cloud. So everybody that registered, both all of y'all that are on, and if you have colleagues that registered but weren't able to get on, everybody that registered will get a copy of both the recording and the presentation. We ask that you use the chat function to ask questions. And with that, I am going to turn it over to TALA's VP of Public Policy, Carmen Tilton.
Hey, thank you, Diana. Good afternoon, everybody. Thank you guys for sharing your lunch with me. We are newly into the first 24 hours of the second called special session from the 88th legislative session. So it's not all the way done, but certainly the bulk of the legislative session is done. And the majority of things that are impacting or that will impact assisted living communities in Texas is done. So we wanted to do, it's sort of TALA tradition for us to do a legislative session wrap up. It's a huge portion of what TALA does. That interaction at the Texas Capitol is part of what you get as part of a TALA member. It's part of, it's kind of our reason for existing in many respects. And so it's incumbent upon us and a responsibility to you guys to kind of give you a heads up and sort of what to expect, what things we saw, and what things we will see over the next kind of year to 2 years before they meet again for the 89th legislative session in 2025. So this is what it was sort of by the numbers. Pre-filing or the start of bill filing actually began right after the 2022 elections, the sort of the week after. We saw an unprecedented, truly a new high watermark for the number of bills filed. A little over 8,000 bills were filed in both chambers. That's sort of elected officials, sort of representatives who serve in the Texas House of Representatives, Texas senators who serve in the Texas Senate, right? Names correspond. Everybody is able to file as many bills as they want to file. Typically, the number of bills kind of comes in around 7,000, 7,500. This legislative session, we hit a new high mark of a little over 8,000 bills. I think in large part because in last session, during last session with COVID, one of the things the legislature instituted was electronic bill filing. You no longer had to walk down there with your pieces of paper and your stamps and everything. And I think once they moved to electronic filing, well, then it became very, very easy to file a bunch of bills. It was a sort of click of a button. And so we saw a significant increase over the 87th legislative session, right? That was the COVID session. We had Winter Storm Uri in the middle of it. But it was also a 10% increase from the 86th legislative session. And I think it's probably going to be a new standard. I think as long as it stays easy to file bills, we'll continue to see this like 8,000 bills filed. TALA ended up tracking, I ended up tracking about 115 different bills. Most of them had what we would consider kind of an indirect impact on assisted living. So for example, there was a bill that would have prohibited construction or improvement to property on any parcel of property adjacent to a body of water that could flood, right? I don't know of a single body of water in Texas that can't flood. So it essentially would have prohibited any new construction on any parcel of property next to a water. We tracked that bill. It wasn't explicitly about assisted living. It didn't have a direct impact on assisted living, but if you're a new assisted living provider in Texas and you're looking to build or you're looking to buy an existing structure and make major remodel, that bill would have impacted you. So I tracked it because it had kind of this indirect impact on assisted living. And the majority of the bills that we tracked of that 115 were in that sort of similar category, right? We weren't the direct targets or the audience, but because of how that bill was framed, it would have had an impact on our members and on the broader assisted living sector in Texas as a whole. Of the topics that did sort of directly impact us, there was a refiling of a previous session's bill related to mandatory emergency generators. And then that one picked up a little bit of speed as well, because not only, last session we had Winter Storm Uri, and that bill was pretty prominent and as kind of a clear one-to-one on here's an emergency or weather event that happened, and here is one legislative solution to it. But then this time around, we had the big ice storm in Austin that took down a bunch of electrical lines, trees and branches and whatnot, taking down lines and poles. And so it sort of resurrected that conversation again. We saw several bills related to staff training. And then we had a big bill which would have created sort of a definition of a senior living community, or what we tend to call sort of an independent living community, an IL, and had some components and requirements around that. And so we were sort of seeing that as like the first real attempt to create a regulatory framework around independent living communities, different from the existing consumer protection and legal requirements and responsibilities under existing statute for consumers. The true legislative session ran from January 10th of this year to May 29th. And in total, about 1,200 bills were sent to the governor. That was an increase from the 87th legislative session, not a big surprise, right? Because the 87th was a COVID session and Winter Storm Uri session. So we expected to see a bit of a decrease in the number of bills that actually made it all the way through the process. But it was a pretty significant decrease from the number of bills that made it to the governor's desk compared to the 86th legislative session. So if you think of it, we had 10% more bills filed this session and 16% fewer bills passed. That's really the comparison to look at. And I think that the reason for this decrease in passage really goes back to kind of, the political impacts of COVID-19. So we saw a lot of bills that would have curtailed or limited the governor's power. And he tends to not be super supportive of bills that limit gubernatorial powers. School vouchers really dominated the conversation. And I think once people got into their political corners around school vouchers or education savings accounts, however you want to call it, that really kind of hit the brakes on a lot of the momentum of the legislative session, because that became one of those issues that then drew a bit of an impasse. We also had in May, you had the anniversary of the tragedy in Uvalde, but we also had the incident in Allen, and that really that not only did it stop the legislative session for about a day or two, but also it pulled up a bunch of conversation around gun regulations, and had used emergency hearings and whatnot. And all of those little tactics, or not tactics, but all those events, and then the resulting legislative actions that happen, particularly when they happen in April and May, all of that delays or impedes the progress of bills that were already in the process, right? So if you have a committee that has an emergency hearing to take up a bill related to gun regulations, well, then that same committee is likely not meeting again to discuss the other bills that were pending before it. And so as these issues kind of came up, you had sort of, say like, oh, the oxygen was sucked out of the room. But really what it was is when you have a strict 140 days, the more you try to cram into that 140 days, the more likely it is that you're going to lose things along the side. And that's exactly what happened this legislative session. We also had two major not challenges to the Constitution, but rather enforcement of existing constitutional provisions. The House expelled a sitting representative, a man named Brian Slayton. And then towards the end of session, the House also voted to send 20 articles of impeachment to the Texas Senate relating to the Attorney General. Veto period ended June 18th. The governor has 30 days after a 22 days after a legislative session to veto bills. And our governor this session vetoed quite a few bills. And then so session ended technically on May 29th of 2023. And then 3 hours later, the governor called them all back in for their first special session. And he said that he would be doing it on property taxes and on human trafficking and immigration stuff. And the human trafficking and immigration bill That one made it through no problem, but the property taxes bill is still an outstanding issue. The House and the Senate really are on two completely different sides of that particular issue. They're really struggling to find some compromise right now. And as long as they sort of stay in their respective corners, we will continue to have special sessions, which is exactly what happened. So the first special session ended about a day and a half ago, and then the governor called them immediately back in for a second special session. And then, and we will just sort of continue to do that until the governor either tires of the process, or they find a compromise, or we make it all the way to 2025, but man, that would be a miserable interim if that's the case. The governor also gave a presentation and said that there are many critical items remaining, which really implies that he plans to call them back in on other issues beyond property taxes, but certainly property taxes is the primary issue that has been added to the call. And then the Texas Senate announced that the trial or the impeachment hearings for the Texas Attorney General will begin on September 5th of this year. So if you're a particular kind of political junkie, September 5th is the day you want to circle on your calendar for watching the live feed from the Texas Senate, which it will all be broadcast and so that you don't have to sit in the Senate chamber and try and watch from there. I wanted to make a chart because sort of comparing passage rates on bills and number of bills filed, because it felt like we had so many fewer bills, and I wanted to go back in time. And one of the things I noticed, so you've got House bills on the top chart, Senate bills on the bottom chart, red for the red carpet of the House, green for the green carpet of the Senate. And you see this big drop on Senate bills between the 83rd and the 84th legislative sessions. And what you're really seeing in that big drop, going from 36.8% passed bills to 24.4% passed bills, 83rd to 84th, we have a new lieutenant governor. So you have the new election of Lieutenant Governor Dan Patrick, and he runs the Senate chamber very differently from his predecessor. And that sort of passage rate in the 20% is a new standard. And you see some drop and some fluctuation, but you're really hovering right around the 20% mark. On the House side, though, so if you look at the upper chart, you're kind of kicking around at that 20% pass mark. And then all of a sudden for the 86 to 87, it drops to 12.6%, and then it creeps back up to 13.8, but that's a pretty significant decline from the 86 to the 87th. And what you have there is a new speaker. So you have Speaker Dade Phelan, who takes control of the chamber from the 87th. And part of it, I think, is just how that speaker runs the House, but part of it is the chamber fight. So the House of Representatives squaring off again, with political disagreements and personal disagreements with the Senate really starts to be a major issue between the two figureheads, so the speaker and the lieutenant governor. And at the end of session, each, the speaker and the lieutenant governor have an incredible amount of power over the other chamber's bills, and they just took turns killing them. That's what we saw during the 87th. They wiped out a whole calendar of bills which otherwise would have passed, that most people expected those bills to pass. The Texas Senate just sort of killed them. And this time around, the Senate just didn't give a whole lot of bills hearings. And it was just sort of an interesting, it's an interesting mark, and really a sort of a data confirmation of what it felt like in the Texas Capitol, which is none of these people like each other all that much. And that's a shame, because when I started working at the Texas Capitol, there was camaraderie and collaboration between the chambers, between political parties. Rural and urban, rural Texas versus urban Texas tended to be a pretty significant split. And what we've really seen is all of those existing divisions have just become enhanced. And so you're seeing a lot more, title of today's presentation, drama and discord in the Texas Capitol. And it's being reflected in which bills actually make it all the way through the process. This is what the sort of disposition of bills looked like. So the House filed almost twice as many bills as the Senate, and yet at the end of the day, the House and Senate were actually pretty close in terms of the number of bills that made it all the way through. What you'll see on the Senate side is, again, on the green side, right side, is the Senate makes a huge first cut, and then it's kind of a steady decline going down. Whereas on the House side, you do have a significant cut, but then you have big cuts at each major administrative step thereafter. What you also see on the very bottom in yellow are sort of all of the bills that made it to the governor's desk, signed by the governor. So those are the bills that typically the governor says, yes, I like this idea, I will put my name to it. Filed without the governor's signature means he let it pass. He wasn't crazy about it. It didn't merit a signature, but it was fine. And then vetoed. We had 76 vetoed bills this legislative session. His average coming into this legislative session was 43. So not quite double, but a pretty significant number of bills have been vetoed this legislative session. And he used it, in his veto statements, he wrote in, this is important, but not as important as property taxes, right? So really indicating, I'm going to veto your bills until you come together and you find the compromise that I want to see on property taxes. And he did that for a whole slate of both Senate bills and House bills. For the House bills, most of the Senate bills were vetoed related to property taxes. On the House bills, he tended to veto them, saying, essentially saying that this is a retribution for not supporting school vouchers. And sort of trying to incentivize them to come to the table on school vouchers. I don't know if that strategy is going to be effective, to be quite honest with you. I think, once the veto period ends, he doesn't have that power authority, right? So like he can't go back retroactively and kill these bills that he signed or even the bills that he didn't sign. The session is done. That power, that cudgel is gone. And so now we're in a special session. And though he has the power to compel members to join, to come to the Capitol for a special session, he does not have the power to compel them to do anything. So technically, members could show up for a special session, say, we're not touching this, and go home. And the governor's powers are really limited. He cannot bring them back, or he can bring them back, but he cannot compel them to file legislation. He cannot draft legislation all on his own. And so it sets up this really interesting dynamic. So by playing this veto card for the regular session, it was one of the final cards that he had to play. But now that the veto period is over, he didn't have that as an option, and he won't have that as an option. So it remains to be seen what he will do moving forward as we're going into these rounds of special sessions. There was an interesting kind of observation that one of the senators made, which is on May 19th, Speaker Phelan and Lieutenant Governor Dan Patrick, that's the top picture, top left, they met, they were chatty, they were in the Senate side, it's green. They were shaking hands and smiling. On May 23rd, former UK Prime Minister Boris Johnson came. He had an address to the Senate. He talked to members of the House of Representatives, and then everything fell off the rails. And so some people were saying like, oh gosh, was that just like this harbinger of sort of death of the session? Is that what threw off the vibes? The reality is no. I mean, everything was building to this confrontation. They were trying to hold it together on May 19th, but truly by May 29th, it was done. And the members were tired of talking to each other, quite frankly. In that kind of environment, so knowing that you've got this friction, knowing that you've got this tension between the two chambers, sort of what does TALA do? And I wanted to kind of call out what our role is, because even when the two chambers are fighting with each other, and even with what we call the big three, which is the governor, the lieutenant governor, and the speaker of the House of Representatives, even when the three of them are all at each other's throats, you still saw 1,200 bills go to the governor's desk. You still saw, a little over 1,100 bills totally passed by the governor and by the legislature. And that means that there's a lot of bills that still impacted us in that. So what I will do and what TALA will do throughout the course of a legislative session is we'll provide a lot of input on draft legislation. So members will come to us, or their staff will come to us, and they'll have some sort of idea, or they'll even have some language that they're working on. And they'll say, hey, what do you guys think about this? And we'll dig into it and pull some research and say, well, that sounds like a really good idea. This phrasing is wrong. That's not what the state calls it. We already do this thing, that sort of thing. So we read a lot of legislation. We provide a lot of feedback on legislation. We help them redraft it. We also represent assisted living communities and stakeholder meetings. So on those bills that we'll be moving forward, we as TALA, we'll sit down at that table of 5 or 6 people, and we'll do our best to represent not just our specific members, but the assisted living sector as a whole, because I think it's really important that everybody in assisted living have a voice at that table, and that elected officials know what they are doing when they're proposing changes to the existing structure and rules. Also testify in committee hearings on bills as they're moving through the process. I gather and organize data for educational background. So when we talk about impact, it's really important to be able to say, you've got, you'll have 46, assisted living communities in somebody's district, and the average size of those communities is 17 or 19 residents, right? And that kind of information to them helps those elected officials to get their head around what assisted living is, because most elected officials in Texas think of assisted living as being very similar to a nursing home. They don't understand that assisted living communities, more than half of them in Texas are small communities. They're licensed for fewer than 16. They're actually typically not filled at a full 16 people. And so when elected officials are oftentimes thinking about big infection control policies, for example, they are imagining a community with 200 residents in it. And they don't oftentimes think about how that impacts a community with 8 residents in it, and how the difference in the number of residents means that the policies need to be reflective of the sizing of that community. So we do a ton of information and data gathering and really help members to better understand their own districts and what assisted living looks like to them. This legislative session in particular, we drafted and redrafted and redrafted legislation. The Legislative Council, which is the body in Texas that writes the laws, like the people that actually put together the words on paper for new laws, they were just super swamped. And we saw the quality of drafting this session was pretty rough. And so oftentimes we had to go back in and we were saying, oh, that's not the right section of code, or that's not the right definition. And so we were oftentimes catching those things in formal legal bill drafts that we needed to have addressed and corrected before that bill actually attempted to make it all the way through the process. Also coordinate visits and phone calls from constituents to elected officials. And then more this session than other sessions, I reached out to the Health and Human Services Commission, right? The state agent, you should all be aware of this. It's your state agency that regulates assisted living in Texas, to just sort of check in with them and see, hey, this bill is going through the process. How would you guys implement it? What does this look like to you? Is there a way we can make this clearer? That checking in kind of fed back into the drafting and redrafting, because if the agency gave me an answer that made me go like, oh, that's a problem, then we would propose new language to try to address those concerns raised by the state agency. This is what it looks like. I'm going to call out this picture on the left because that is the most uncomfortable chair in the entire Texas legislature. It looks like it has padding. It does not. That back is straight back with a slight lean forward. It feels like you are falling out forward. And when you have to sit in it for hours waiting for 2 minutes of testimony, it is torture. So that's why I get paid, and that's why I do what I do. But note that I am saving you the torture of having to sit in that particularly uncomfortable chair in the Texas Senate, where you're not allowed to eat or drink anything either. You just sit there and you stare at the railing and you stare at the members and you wait for them to call up your name. I wanted to include, one of the things I realized is you all may not actually know what it looks like to work on these bills. And so I wanted to give you an example of a bill that we spent quite a bit of time working on, which was generators in assisted living communities. So the bill as it was filed would have required every single AL in Texas and all nursing homes to have a generator on site, so permanently installed on-site generator with enough on-site fuel to power the machine for 72 continuous hours. And then if you had an Alzheimer's certified area, you had to have a separate machine. So you had to have 2 generators in that building. So one to portion the Alzheimer's certified area, and then one to portion the rest of the building. And then your equipment would have had to have been installed by September 24th. As you can see in those requirements, I think well-intentioned, and certainly coming out of Winter Storm Uri and the ice storm in Austin, I think there was a lot of justification behind something like doing something around emergency and backup power. But having equipment installed by September 2024, particularly coming out of COVID, still in COVID recovery, but also just that kind of equipment is in really short supply. Electricians are in really short supply. Having 72 hours of continuous fuel on site has all sorts of implications for those of you guys who are in urban areas. It just had, there were some components, and then of course the cost of the equipment, the cost of rewiring. It had some components to it that were really going to be impossible to meet. Some, there is just truly, like, some providers were going to be fine and some providers were simply not going to be able to do it. And so one of the things that I did as part of our advocacy is I pulled data on types of assisted living communities, sizes of buildings, locations, right? Because if you were out in El Paso, you're not on the Texas's grid managed by ERCOT. You didn't lose power during Winter Storm Uri. You're nowhere near a hurricane zone. Maybe it didn't make sense for those communities to have backup power. They haven't had the same experience with widespread and continuous blackouts the way that other places in Texas have. And then I pulled incident reports from the Health and Human Services Commission to see, how frequently are these issues? Are there any negative outcomes? What has been our experience with continuous and extended blackouts? And the reality was, though there have been quite a number of communities that have been impacted, it wasn't as widespread as you might have thought, certainly not as widespread as you would have expected given just the magnitude, particularly of Winter Storm Uri. I mean, it hit every single county in Texas, but only about 30% of Texas 30% of Texas ALs reported that they had lost any power at all. And then most of them had their power back within the day. And so one of the things that we do is, we gather all this data, we pull all of these numbers together, and then we go back and we talk to the bill author and we say, hey, we see what you're trying to do. Here's the data to help to support maybe some modifications to this bill. And then we make connections, and we have our, people who came, TALA members who came to TALA's Advocacy Day on March 1st, went around and as part of their conversations that they had with offices would sort of describe what their emergency preparedness looks like, how they took care of their residents, what outcomes they saw, what things their company is doing differently now in a post-Uri world. And I think all of that information and education was really useful for both that office, the office of the bill, the bill author who's filing the bill, but also to other elected officials to help them to better understand how impactful extended blackouts have been, how really incredibly well assisted living communities have responded to extended blackouts, and maybe to give them a little bit of perspective in how the implementation of some sort of emergency electricity or emergency power system, how it would actually need to look to reflect the communities that are in their individual districts. And so what we saw in a committee sub on this bill were some really big changes. And we're certainly really grateful for a lot of the changes and modifications that were made. There were still some weird, again, drafting quirks, right? That were kind of pieces that needed to be cleaned up here and there and here and there. And then ultimately, as conversations were happening, the committee that oversaw that particular bill decided that they'd rather not pursue it as a legislative issue. Do I think it's going away? Nope. I think it'll be back this next legislative session. It'll be a continuous conversation as every time we get some sort of ERCOT alert, every time there's a storm that rolls through and knocks out power, I get media requests asking about assisted living communities and what they're doing. So it's top of mind for a lot of elected officials. It's an issue that we will continue to address and that we'll need to address. And so, all of our big ask and our big effort on this is just to make sure that whatever ultimately gets passed in law is reflective of the diversity of assisted living communities in Texas, because they're incredibly diverse. When we would go around and we would talk to legislative offices, oftentimes we'd hear, so what are you guys working on? And what do you guys want us to file? And honestly, it was just stop. We are still working through implementation on last session's bills. So last session, between COVID and Winter Storm Uri and all of the money and federal stuff, I mean, there were a ton of new bills that passed. I mean, I was looking back at like the implementation chart that I had from last session, and it went over 2 pages of just like, all of these things that were coming through. And so what we said really this session was like, we don't know, we don't have enough information about what's working and not working based on last session's changes to even start to begin contemplating changing up what things are. I'm just going to call out as a reminder for everybody on this phone call, you are still required to do your federal funds reporting. You've got that requirement in statute, excuse me, until September of 2023. So get your federal reports in. And those are going to the Health and Human Services Commission. And then we have ARPA grant dollars, which the deadline to finish spending those dollars is July 31st. You have to report on those dollars by August 31st, right? So just top of mind, those two issues are still ongoing and current. But yeah, I mean, we had so many changes this last legislative session. Oftentimes what we would say is, you know, keep us in mind if something comes up, but really we'd much rather focus on correctly implementing what the legislature did in 2021. That said, we had a few legislative goals. One of the things that became apparent sort of post-COVID is that the Texas statute related to long-term care ombudsman, so what's in Texas's statute, is not the same or even substantially similar as what is in the rules and regulations put out by the federal sort of Older Americans Act and the federal ACL agency. And so we had a bill that would have aligned Texas's statutes with those federal rules and programs. We also knew kind of coming out post-session that, or not session, post-COVID, that staffing agency and price gouging had been an issue. And so we wanted to address, or at least have some kind of language around price gouging. We're always supportive of efforts to improve HHSC surveyor, the survey process and training and consistency. And then of course, we always support initiatives that impact all seniors, not just those living in our communities. And we have a few bills that passed this legislative session that are big wins for seniors across the state, but including those in our communities. The bills that did not pass, several of them were refiles, right? So mandatory generators had been a refile. It was filed last legislative session. It was filed again this legislative session. The new regulation of senior living communities, right? It would have created a new regulated type. It would have required background checking of employees and communication policies to residents. And it was a whole thing. There was a new cause of action that it created as well, which is a justification for a lawsuit. We saw a refile that would have required, again, all assisted living communities in Texas to have an infection prevention and control committee that, quite frankly, is more extensive than what you see in hospitals. That was one of those ones where we had to really kind of go in and say, hey, 53% of communities are licensed for 16 or fewer beds. They don't have 6 people on staff who can sit on an infection control committee. We saw limitations on public health directives. We saw attempts to increase the minimum wage. We saw attempts to permanently prohibit local municipalities from increasing the minimum wage. We saw requirements to do mandatory paid sick leave or paid vacation days. We saw bills that would have prohibited putting in mandatory paid sick leave and vacation days. Some of those are issues that we'll see every legislative session, and they're not specific to assisted living communities, but again, they have that impact on our folks. New in this session, we saw, it's an idea that we've seen floated around a few times, but a bill that would have required, essentially, if any assisted living community has a resident who has a diagnosis of Alzheimer's or dementia, the bill would have required that assisted living community to be Alzheimer's certified. The implications on that would have been huge. I mean, really, really huge. And that was, again, one of those bills where we went in and said, hey, your heart's in the right place, but let's talk through the real challenges that concept puts forward. Same thing on an employee's right to privacy of health information. So you can't ask an employee for health information, right? Are you vaccinated? Couldn't ask them about risky behaviors or not risky behaviors. You just had to treat everybody sort of the same. We talked about the construction bill. Minimum staffing ratios is it's a concept that gets tossed around a lot. This one would have actually put it into statute, required background checks, allowing tenants to terminate leases. And then there's a couple of issues that may come up on one of the special sessions. One, it relates to coercion to receive a COVID vaccine. it was an issue that came up during the legislative session, and the way the bill had been drafted is essentially said that the recipient of the vaccines, the patient, would have to be able to give affirmative consent if they wanted the vaccine, and you couldn't have another party, right? A parent or guardian in the case of a child, or a legally authorized representative or guardian in the case of an older adult with Alzheimer's or dementia. You couldn't have this other person consent on behalf of the patient. And so that issue got cleared up as the bill was in the during the regular legislative session. And then there was a component in there about coercion related to employers. So if employers asked employees to be vaccinated, that was considered coercion. And then they again, through a lot of conversation and education, they created a carve out for healthcare facilities, and assisted living communities are considered healthcare facilities. And so that bill, one, the bill didn't make it through the legislative session, but two, it required multiple rounds of conversation and fine tuning. And I think if that issue comes back up in a special session, we'll have to restart a lot of those conversations again, because while the bill ultimately got to a spot that we could live with, it took a lot of work to get it to there. Another one that was sort of a flag, and it was a little bit of a challenge that sort of saw, was not a prohibition on putting up a 30-7 or a 30-6 sign, but rather the elimination of the enforcement of it. So if you had, so 30-6 is, I'm gonna get these flipped. One is no guns at all, and one is no open carry, so concealed carry only. You would be allowed to still have the signs, you'd be allowed to still have the policy, but you would not be able to enforce it. You couldn't call law enforcement and have them remove the individual who is carrying in a space where they are not supposed to be carrying or in violation of your policies. Again, not the end of the world, but when we're talking about a healthcare facility, when we're talking about an assisted living community where you have residents with Alzheimer's, dementia, or just a lot of people with fluctuating capacity, it makes me uncomfortable to also introduce weapons. And I know a lot of our communities have those 30-6 and 30-7 signs. And so we want to make sure that we want to protect our providers' rights to decide whether they feel comfortable with firearms allowed on their premises. Let's talk about the bills that did pass. So House Bill 1673 is by far the most impactful of the bills that passed. And I'm going to go over it, and I'm going to go over it quickly. And here's why I'm going to go over it quickly. And I will say this twice, just in case you're like eating chips or something and you miss it. This bill is impactful, not necessarily to communities, but certainly to course providers. So like TALA's manager course will need to be modified to reflect the requirements in this bill. But nothing will happen until the Health and Human Services Commission decides how it wants to interpret the bill. So you don't have to do anything with it today. You don't have to do anything with it for quite a while. We will let you know when these new training standards are in place. But between now and December 31st, 2024, there will be the implementation, the rulemaking process and interpretation process of this bill. So what it does essentially is every assisted living community, which is not Alzheimer's certified, so the 2/3 of communities that are not Alzheimer's certified, but who have a resident within the community with a diagnosis of Alzheimer's or another related dementia, the direct care staff, the manager, and then any other ancillary staff in the building who would have incidental but reoccurring contact with residents are required to have a certain amount of training in some Alzheimer's specific topics. So let's start with the staff who are incidental but reoccurring contact. What that means is like your front desk person or housekeeping, right? Somebody who goes into the residents' rooms. What it may not mean is like your plumber or a yard guy, right? So if you have staff who come onto the property for just little bits of time and they're really not, somebody's in your back, business manager in your back office, they're not seeing your residents, they're not interacting with your residents, then that person doesn't need to have this additional training. But if you have other people in your community, even if they're not caregivers, but who are around your residents, then they need to have at least some minimum training and related to Alzheimer's and dementia. And I'll show you that I actually think most of your trainings cover the topics that are in this bill. So anybody can create the training, whether it's an outside company, a nonprofit like TALA, or you can do it as your in-house training and shadowing. You have to have some sort of competency-based evaluation on the end. That can be a return demonstration. It could be a test, a multiple choice test, however it is. And then, like I said, the topics tend to align with existing training standards. So let me show you what it looks like. Okay, for managers, existing manager training on the left, the bill's requirements on the right. The bill does not increase the number of hours required. So within the existing AL manager course, those managers will now need to cover the topics on the right, that listed on the right-hand side. And what I was sort of noting when I went back and I was looking at the existing administrative code and rules for manager training for non-Alzheimer's certified communities is that these topics are in many respects already covered, right? So resident characteristics, including dementia, man, that sure seems like it would check the box on Alzheimer's disease and related disorder as just a topic. Resident assessment and skills working with residents sure seems like that covers the same topics as assessment and care planning, provision of person-centered care, daily life activities of residents with Alzheimer's or dementia. Community resources matches up with the community resources in purple. Basic principles of management. We cover, at least in the TALA course, we cover staffing. We talk about making sure that you have enough staff to take care of the residents and all of their needs, right? So again, TALA will go back through, we will modify our course to highlight a few of these extra components. We'll probably emphasize some of the Alzheimer's and dementia pieces a little bit more, but I don't see them as being new pieces to training. This is what it looks like for direct care staff who care for residents with Alzheimer's or dementia. Again, you guys are already kind of doing these things. So you've already got symptoms of dementia, person-centered behavioral interventions, right? You've already got these pieces. They're not called the same, but the content is likely very, very similar. Now, what you may do, you may modify your existing training courses to give a little bit of emphasis, a little bit of clarity, update it to reflect current thoughts and guidance related to Alzheimer's or dementia, but you probably should have done that anyway. Or as course providers, we need to do that on a regular basis. And then for your all staff. So existing all staff are required to be trained in residents' rights, and the residents' rights, as you'll see at the bottom, they include things like communication and meeting residents where they are and interacting with residents and creating a safe and decent living environment. Your staff are required to already be trained in those residents' rights. And so what you will likely do as communities is you will modify that 4-hour orientation for those staff members when you're covering those residents' rights. You're just going to make sure that you're addressing Alzheimer's disease related disorder, common behaviors and communications. I think it will make, for communities where these ancillary staff members have some interaction with residents, but not a ton, I think it will improve kind of how they perceive their job, right? So if you're working front desk, understanding a little bit more about your residents with Alzheimer's or dementia, it can only make things better. And then the important part was that everything is under existing training standards and existing hours. So you're not having to create new hours. You're not having to sign somebody up to sit in front of the computer for a lot longer. It's about emphasis and clarity and a little bit of specification inside the existing training standards. We're going to quickly go through other new rules, new laws, most of which, again, there's nothing that you need to do right now. You will see guidance on them. You will see information on them moving forward. So there's going to be a streamlining. The legislature directed the Health and Human Services Commission to streamline some background check, the employee misconduct registry, nurse misconduct registry. There's a few other ones for daycare providers and whatnot. They're all going to be consolidated. It'll be a single registry that you check. Yay. Food service establishments, including commercial kitchens, which those of you with large communities, you have a commercial kitchen. You've got to have a poster up related to food allergen awareness. Chances are you probably had something like that up already. The Department of State Health Services will create the poster. They'll disseminate it out to you guys. just have to wait for that to come out, and you post it in an area accessible to food service employees. It doesn't actually have to be inside your kitchen. It just has to be accessible to employees. The Senate Bill 401 empowers the Attorney General to go after medical staffing agencies for price gouging during a declared public health disaster. House Bill 4696 streamlines some of the abuse and neglect and exploitation investigations in assisted living communities and other licensed care settings. So right now, if a family member is concerned that a staff member from an assisted living community is abusing or neglecting a resident, that complaint goes to the Health and Human Services Commission. But if they think that the person who is engaging in abuse and neglect works for a private hospice agency, then that complaint would have gone to the Department of Family and Protective Services, DFPS. And what this bill does is it says, look, just one single number, one single complaint process. The two agencies will handle it out on the back end, which again, will make it just easier, a little bit simpler. You don't have to kind of keep track of like who's a staff member versus an outside person. If it's in your community, the complaint goes to the same complaint intake that you are already using. Representative Bowers has a bill that requires law enforcement officers to be trained in communicating with residents or with individuals with Alzheimer's or dementia. Representative Cody Vasut passed a bill that says that if you have an employer who does not have a vaccine mandate for a pandemic disease, then it's sort of up to the employee to keep themselves safe and protected. So if the employer doesn't have a vaccine mandate and the employee does not get vaccinated, the employer is not responsible for that employee contracting the exposure or having been exposed, contracting the virus on the job site. Makes some sense. One thing that I will pause and just sort of note real quick is that those of you who are TALA members, I have a really nice summary sheet on the members section of the website on documents for download with all of these bills listed out and some information, and then hyperlinks if you want to go back and read the text yourself. And then of course you'll have this presentation emailed out to you as well. I'm going to get to a good stopping spot and then we'll do a Q&A. There's a scholarship for nurses. The Texas Higher Education Coordinating Board will put together all of the information about that, and then they will push that out, and that will likely be promoted by the Texas Board of Nursing. Representative Julie Johnson passed a bill requiring some health insurance plans to cover hearing aids for both adults and children. Senator Huffman, Representative TALAHour passed 379, which creates a sales tax exemption for wound care dressings and incontinence products, as well as diapers and maternity products. And there's a whole range of additional sort of family products, but for our purposes, wound care dressings and incontinence products are included. And then we have this bill, which you guys may have heard referred to as the Death Star bill, which is why it gets the fun graphic. And the reality is we don't know what this bill is going to do. I've talked to a bunch of different people about it, and the only thing everybody seems to agree on is that the impact of the bill will be decided by courts. So essentially what happened in House Bill 2127 is the legislature passed this bill, and it says that local governments may not make new codes or ordinances in topics that are governed by the following state statutes. So there's an agriculture code, a business and commerce code, finance, insurance, labor, local government, natural resources, occupations, and property. That is a lot of codes, a lot. And by saying that local governments may not make ordinances, what essentially they're creating is saying whatever is in existing Texas statute is the only limitations in those areas which may be enforced by local governments. And when asked and pressed about, well, does that apply to noise ordinances? Does that apply to public waste removal and disposal? Does that apply to roads? The answer was maybe. Yeah, maybe. The example that I like to think of is the city of Austin has a hard limit. I'd like to put in chickens in my backyard. City of Austin has a municipal ordinance that limits my number of chickens to 6. But with this bill, I could have 8 because Texas's statute is silent on the number of chickens a residential homeowner may have in their backyard. Now, the enforcement on this, like what would happen likely is that I would try to put in too many chickens in my backyard. I would get a letter from the city of Austin. The city of Austin would say, hey, our ordinance says 6, you have 8. And then I would go back to the city of Austin and I would say, yes, but House Bill 2127 says that you're not allowed to enforce an ordinance that's in one of these codes or that's related to one of these codes. And so we'll see you in court. And if I really wanted to push it, I could take it to court. And then the court would decide whether or not the city of Austin has justification to manage or to enforce that ordinance. That's a lot of effort on something like some extra backyard chickens, but there are other bigger things that really could come into play here. And the reality is we just don't know how courts are going to look at this particular bill, but you have to mention it because it has huge implications for all sorts of things in Texas: land use, neighbors' rights, your rights, property rights, occupations codes, water breaks for employees. I mean, just tons and tons and tons of implications. So what's next? We're in special sessions. The Texas Health and Human Services Commission will start to do rulemaking and implementation on all of bills related to them. Department of State Health Services will make rulemaking and implementation on bills related to them. We're just going to sit back and we're going to wait for those. Well, you guys will sit back and wait for those agencies to release their rules. We will begin engaging with them and working through, right? I'll show them my fine color-coded chart and I will say, hey, these existing topics are contained, are already encompassing these new topics. And we'll start to work on one-on-one on sort of a crosswalk. So we'll engage on all of the rulemaking pieces, but in terms of like what you need to start doing tomorrow, just waiting. I mean, comply with your federal funds report, but you're just waiting. I wanted to pull up a couple of pieces of information related to special sessions. Going into a special session is not unusual. In fact, it has happened more often than not. A special session is required. It lasts no longer than 30 days. It can be shorter. There's no minimum length of time. The governor sets the topic, but the legislature crafts specific bills, which is why I said, the governor can keep calling them back in, but the legislature really could show up and say, no, thank you. And then they adjourn sine die. And then the governor only has the power to call them back in again. He had multiple special sessions after the 87th. Where he had 11 items on the first call, 18 items on the second call, 10 items on the third call. So we're used to this at this point. It just remains to be seen whether or not there's going to be some compromise. And like I said, really, truly in terms of impact, it's implementation depending on interpretation. And this was one of my favorite and also most mind-numbing paragraphs, because this is cut and pasted straight out of a bill that passed, and it doesn't make sense. It doesn't make sense. It is a collection of buzzwords with very little relation to each other. And one of the things that we will do is we will go to the state, Health and Human Services Commission, and we will offer up a potential interpretation of this language, and they will craft their interpretation of the language, and we will bring in the bill authors and we will bring in other stakeholders. But I mean, I sort of joked. I was like, it was like being a senior in high school English class again. I was trying to diagram this to figure out what tied back to what. And I just don't, it's just really poorly written. Okay, so here are your to-dos. If you are not already subscribed to the TALAHour newsletter, you need to do so. We will send out information on implementation and things you need to know about bills as they are going through the process. We send that out monthly. We have the TALA lens on our website, which is a blog post or a blog format where we do in-depth articles on all sorts of issues. We will do one on the legislative session, but we'll also have workforce and cost. It's really, really cool. The blog posts per, when you've got that extra kind of minute and a half. If you are not already subscribed to Gov Delivery from the Health and Human Services Commission, you need to be subscribed to Gov Delivery. you need help with that, shoot me an email. You can shoot me an email at carmen.tilton@tala.org. That's the best way to get a hold of me. I'm going to take a small vacation in a couple of weeks. So if I'm a little slow to respond mid-July, I will be back in full force after about the 13th. And then finally, thank you. Thank you for giving me your lunch. We have another TALA hour on July 14th with Lori Tamayo, who is doing one on data security and healthcare facilities as targets for hackers. It's going to be a really interesting and super informative TALA hour. So please go to the TALA.org website. You'll see a graphic and information about it. Click on it. It takes you to register. You guys already know how to log on. We have information about upcoming events. We have an annual TALA conference. Our next one is going to be in San Antonio in April of 2024. And then, of course, if you need your AL manager's course, or if you want to just get an update on rules and regulations, all of that information can be found on the TALA.org website. Okay, with that, I'm going to pause. I'm going to take any questions if they have come in. Diana, have you been seeing questions come in?
I have not. We have one person that has their hand raised that I reached out to you on the chat. Cindy, I'm going to allow you to talk if you want to ask your question, if you're still there. So I'm going to hit that button. Cindy, you there? You have to unmute your button for you to be able to talk.
All right. Thank you. And I'm sorry, I do not have a question, although I'd like to say I appreciate this.
Great. Thank you. That is the first time I have actually used the raise your hand, and that worked really well. I liked it.
Good.
I'm going to go back to, like I said, everything is accessible via the TALA.org website. There we go. And then again, sort of far right-hand side, you'll see my email address. It's carmen.tilton@tala.org. Our contact information, my contact information, Diana's contact information is always available on the TALA.org website. So if you ever need to get a hold of us, that's the best way to do it. You can always find us there. But truthfully, we will send out alerts. We will send out reminders. We will let you know. So make sure that if you are subscribed to the TALAView newsletter and you're like, I really haven't seen one recently, you should have seen one recently. One went out recently. So yeah, it means that it's probably going into a spam folder or spam filter, and you'll want to manage any of that sort of stuff. Again,
Carmen,
same thing for gap delivery.
You have a question. It's not related to your presentation, but
yeah, the federal funds.
Yeah, something that you have provided a ton of information to folks.
Yeah. So federal funds reporting. This is not, despite the terminology, it's not the federal funds reporting that you have to do, or that some providers have to do to the federal agency. Last session, the legislature decided that there was so much federal money coming into Texas and going out to providers, and they had no idea, money that was sent straight from the feds to providers, the state wouldn't have any information about. So the legislature passed a budget amendment that said that every single healthcare facility, and there's a whole list of licensed healthcare facilities, has to report on the receipt of any federal funds they get monthly until September of 2023. So every single assisted living community, regardless of whether you have received a penny of federal funds, right? ARPA grant money, because that came from the state, you don't have to report. But if you got CARES Act funding, for example, or you got some other specific grant from the CMS or from HRSA or one of the federal agencies, if you got any federal money direct from a federal agency, then you needed to report the quantity, how much money you got. If you did not receive any money, you have to report $0. So you still have to report, even if you're just going in $0 received this month. Nope, still haven't gotten anything. And then in terms of it being like in kind, so if you got masks or whatnot, you do not have to report the in kind. You don't have to create some sort of like formula for, well, you know, masks, when we got them, the market price was 75. Like, nope. If you guys got a distribution of equipment, or you had a strike team, or you had, you know, something like that, it doesn't have to be reported. So it's only dollars. So you're reporting dollars, the quantity of dollars, and the month that you receive those dollars in. And you have to make the report even if you're reporting zero. And if you need some help going back, or you haven't been doing this report, we're now like, you know, almost 2 years into this process. And so you've got a lot of reports to fill out, let me know. I can connect you to the people at Provider Finance, which is the team at the Health and Human Services Commission in charge of the federal funds reporting. And they've got a mechanism and a process for getting providers caught up who haven't been making their monthly reports.
And if you are a TALA member, Carmen had a very huge effort that she undertook where she actually was monitoring the not reporting list and reaching out to our members, letting them know what they needed to be reporting. And that was ongoing for a period of time. If you were not a TALA member, getting help from us on anything directly with Provider Finance or with HHAC, that is a membership only benefit. We do webinars in the TALAHour that are open to everyone. We don't require membership for those things. But if you're getting direct assistance from us on a project, be it Carmen or myself or Rose Signs or anyone else in the office, that is a membership only benefit. And if you're not a member, I'd strongly encourage you, please reach out and become a member. We'd love to have you.
Yeah, I mean, I'm going to make a secondary plug. I think what TALA offers for the price point is really an incredible, and we do a ton of one-on-one assistance. So non-members, oftentimes what we'll do is we'll point you in the right direction, or we'll say like, hey, here's the website that Provider Finance has put together on this. As TALA members, oftentimes we'll do the introductory email. We'll say, hey, this is this specific person you need to talk to. This person will help you out. Here are your files and folders. It's in part because there's nearly 2,000 assisted living communities in Texas. We don't have the bandwidth to do that kind of personalized attention to every single entity out there. And also, if you're not a member, then we don't exist. You know, I mean, I love my work, but I would not do it for free. So please help to support TALA and all the great things that we do. Even as we advocate on behalf of all assisted living communities, because we're not going to split hairs there. That seems ridiculous. And then Diana, do you see Mary's email?
Yeah, Mary, reach out separately to Carmen via her email address right there, carmen.tilton@tala.org, and she'll at least send you the Provider Finance website page.
Yeah. All right, it is 1:03. That's it. That's all the news there is to print today. Like I said, if you've got any questions, you're always welcome to email. We have a ton of information on our website. We have a TALA Lens article as well. Yeah, thank you guys for joining us today.
Thank y'all. Hope to see you on July 14th. And with that, we are done. Thanks, Carmen.
Thanks, Diana.